All right, we're back on Morning Line. It's our final segment, talking to Dr. Kim Sandler. She is co-director of the Vanderbilt Lung Screening Program. I'm curious, and I'm sure you are, to know why the other co-director is not here. Kim?
He's probably treating patients as we speak.
Give me some. All right, we've got another phone call for Kim, who, that's right, they're multitasking over there at the screening center. And let's go to Bruce. Bruce, good morning.
Are you Nick?
Hey, Bruce, what's on your mind, my friend?
I just heard you all talking about getting something about soil, and in February of '97, I was diagnosed with Wagner's granulomatosis, and Vanderbilt was the one that discovered it. But they sent me to the doctor, Dr. Howard Fuchs there at Vanderbilt. He's a rheumatologist.
Mm-hmm.
Okay.
Mm-hmm.
But anyway, they wouldn't blame that on smoking. Of course, I had smoked some back then. I've not since. But when you mentioned that about soil, that that came to mind. And they told me at Vanderbilt that I could have got this infection from soil.
Okay, that sounds like could have been histoplasmosis, right?
So Wagner's, or what we also now call granulomatosis with polyangiitis, is more of an autoimmune process where the immune system can cause some of the abnormalities in reaction to certain antigens. And I believe Dr. Fuchs is in rheumatology and does a lot of work with autoimmune disease. So it is a different type of abnormality in the lungs. What's interesting is that it can cause things that can mimic lung cancer. So that type of granulomatosis or with polyangiitis can cause what we call cavitary lesions, where there are little holes in the lungs. There are certain lung cancers that can look very similar to that. So it becomes very complicated in patients, particularly those who have smoked, to try and determine if something is related to a benign process or an autoimmune process as opposed to a malignancy or a cancer. So it's really important to have those baseline scans done and to have those diagnoses made so that then if something changes, we can say this is then suspicious for something like cancer.
You know, it's interesting just hearing him and you talk about lungs. I'm trying to think of the way illnesses enter our body. When you think about it, aside from orally, or perhaps skin, or if you're injecting or something like that, it's breathed in, right? I mean, we breathe it in. Now, it may come through your nose and you may have mucous membranes that are cracked and it can get into the blood system that way, but a lot of stuff gets into your lungs and it goes from there, doesn't it? I mean, you think obviously tuberculosis. My personal favorite, hantavirus. Have you ever had to deal with that?
Not personally.
Oh, I dealt with that in Los Angeles. That was no fun. That can kill you really fast. But I'm just thinking, a lot of stuff gets into the lungs, and then from there, not that it necessarily becomes a lung-based, but then it spreads from there. Or when you get in the winter, I get every Christmas, it seems like I get horrible chest congestion. Be it a virus, or it settles in my lungs, right?
Sure. So we have malignancies like cancers that cause problems in the lungs. We have infections or inflammatory processes. We have autoimmune diseases that can cause problems in the lungs. So they're all different hosts of causes for abnormalities.
And that's where it gets started. But again, it focuses on cancer, but a lot of these things are all interconnected to some degree, aren't they?
Can be.
Let's go to Todd. Hi, Todd.
Yes, sir. I got a question for Dr. Sandler.
Sure.
Y'all was talking about the soil and that. I failed to mention I worked in a zinc plant, and I was exposed to lead, cadmium, and I was removed from my department twice because of high lead levels in my blood.
Oh, boy. Todd, you called earlier, right?
Yes, sir. Now, I won't be brief.
No, that's okay. Hey, how do you feel right now, Todd?
I'm weak. I don't feel well. I'm not in good shape.
Is there any pain? Do you have pain?
I'm sorry?
Do you have any pain? Does something hurt?
Oh, yeah, I hurt all over. My back, my neck. I got migraine headaches. The other question I was going to ask Dr. Sandler was about these patches, about trying to quit smoking. The one, I don't know the name of it, but I know there's been a lot of talk about people, if they put the patch on, they want to commit suicide, or it's got a tendency.
Oh, I see. Well, I always hear about Nicorette gum, and I don't know, does Nicorette make patches also? There's nicotine patches, correct? Is that the type of patches that are used?
I imagine that's what he's asking about. So anytime you use any sort of medication, there can be a side effect. And it's important to understand that these gums and patches are all different types of medication. We know the terrible things that can result from smoking.
Okay.
And so things that you can do to help yourself quit smoking, the benefit is been shown to outweigh the risk. Now, it doesn't mean that there aren't risks associated with different types of treatments. And I don't know specifically the patch that he's asking about or the specific side effects that he's asking about, but I think it's important to use products that have been proven to work and to help people to quit smoking with limited side effects.
Even in Todd's condition, and if you're with us, I'm going to be thinking about Todd for a while because I worry about him and just his health. Stopping smoking for him now is not a lost cause. I mean, even now, as late in the game as it is for him now after 30 years, it's still positive, right?
Right. And as we mentioned earlier, Todd, if you can, please go and see a provider. I understand it's very challenging with insurance limitations and things, but I mentioned our website earlier. There are phone numbers there to contact us. We're happy to help people to find ways to cover the exams if it falls outside of insurance parameters, but it's really important to see someone. And yes, anytime you can quit smoking, it's a huge benefit to your health. We know that the risk of developing lung cancer when you quit smoking, the risk goes down precipitously.
Yeah, so it can make a big difference. And
absolutely.
Yeah, Todd, stick around because we'll have that information up at the end of the show after we wrap up with her. And it's a secondary benefit from this. But the moment you quit smoking, you improve your bank account. I mean, I don't know. I don't smoke, but I was stunned the other day when a pack of cigarettes, how much they cost. Holy cow. If you can find a way to kick the habit, you're going to save a lot of money too. You know, I mean, it's just something else to think about. But number one would be your health improving. Let's go to Rick. Hi, Rick.
Hi.
Hey, what's on your mind?
Oh, good morning, Nick. Love your show a lot, and it's very informative. Listen to it all the time.
Thank you.
I just wanted to make a comment about the COPD. My friend Tom passed away it's been a year ago now, and I took him up to Skyline for a bunch of cancer tests and in his radiation treatment. He had COPD for like 2 years straight. And all of a sudden they come down and said that he had stage 4 small cell lymphoma, I think, or something like that. But anyway, he just kept getting worse, but it's just, I don't understand how you can have all the COPD and then it just goes straight to cancer. Can you explain that to me?
Hey, thank you, Rick. Yeah, all right, fair enough.
Sure, and I don't think the cancer necessarily develops from the COPD. So we know patients who have COPD are then at a higher risk. If he had something like a small cell lung cancer, that can spread very, very quickly. It can grow very quickly. It's one of the reasons that cancers like small cell can be more susceptible to treatments with chemotherapy, because the therapy will target rapidly dividing cells. So cancers that sometimes grow more quickly or can act more aggressively are more susceptible to some of our treatments. Now, unfortunately, our treatments for late-stage lung cancer are not where we would like them to be. But it is possible that if he had certain studies like a chest x-ray or even a pulmonary function test, that won't show the abnormality. The study I mentioned earlier that showed the reduction in mortality was CT scan compared to x-ray. Things need to be much larger. So it depends on what type of study he had. Our studies aren't perfect, but there are certain types of cancers that just can grow very, very rapidly.
Okay, real quick as we wrap things up, just in terms of the treatments, you touched on it. You know, once you discover it, if you do these screenings and you catch something, there's all types of treatments, especially early on. It's removal, right? It's chemotherapy, some of the same traditional cancer treatments for other cancers?
Yes, so the best thing we can do is a cure. We are always trying to cure, and the best way to cure lung cancer is to find it early and to take it out.
By removing it surgically?
Yes.
Okay, get that out of there. And then following that up with chemo or radiation to make sure nothing kind of was around it?
It depends. We've had some patients that have had tumors that are so small and cell types that then did not need chemo or radiation therapy. We cut it out, and then we did serial examinations to monitor the patient and make sure that nothing comes back. Okay. So if you find it early, sometimes you don't need those additional therapies. The later stage and different types of cell types will require chemotherapy and sometimes radiation therapy, depending on where they are and what type of treatment they require.
All right, and I told you about my friend who, you know, it's not a close friend, he's just someone I talked to at with his wife, but he had a 3 or 4, stage 4, and it's a specific lung cancer treatment that was experimental, and he got into the trial, and it worked. So I'm assuming there are more. I don't know if he was at Vanderbilt. He may very well may have been. I think he was at the Sarah Cannon Center. Is that affiliated with Vandy, Sarah Cannon?
It's a different hospital. So we have the Ingram Cancer Center.
Okay, that's right. Maybe he was at Ingram. I can't say if it was Sarah Cannon. It may have been Ingram, because those are two names that pop into my head. Sure. It was one of those two. But you're constantly doing experimental treatments as well and trials, and this one worked for him.
Yeah, and we're really moving towards immunotherapy, where we can actually have the patient's own immune system fight the cancers. And some of the newer commercials that you see for lung cancer, for later stage lung cancers that have then been treated, are really focusing on those immunotherapies and helping the body to fight the cancer.
Yeah, well, we're lucky we have these centers, and the two that we just talked about and others, and the screening process. Listen, I'm gonna, after we say goodbye to you here, I'll come back up and make sure to let everyone know where they can get questions, clinical questions can be asked.
Absolutely.
Appointments, as you said, also people like Todd, if they call, can maybe get some insight into where else they can seek help if he's in a pickle like he is, correct?
Yes, absolutely.
Because it's a matter of life and death, really, is what it can come down to.
Thank you.
Dr. Sandler, it's a pleasure having you come on. Thank you. You're really, really good. You answer the question. And this is super important, folks. Take note of it. Look, stick around. I'll have these numbers for you as soon as we come back after this. Thanks again.
Thank you.